Hello, welcome to class. Today we're going to be talking about single subject research designs. How do you do research with only one person? This is the way that we'll figure out how to do it. This is really applicable for anytime you're in a social work practice and you want to try out something new and you want to bring a little bit of systematic rigor to it to understand, does this new therapy or intervention work? And so you can start out real simple. Maybe you only got one person to work with. This is the way that you would start it. So let's dive in. So the single subject design, as I mentioned, it's with one subject or participant. This would be, say, an individual, but as we know as social workers, this could also be our client, whoever our client is. It could be a group or it could be a community as well. But it is one entity. Now, if you've had a class with me before, and perhaps it was one in which we were doing a case study and trying to work through how do we do as social workers to work through a case study, then you might remember the engage, assess, maybe set some goals, intervene, evaluate, terminate, or the EAIT acronym. And this actually parallels that process. So it should feel a little familiar. And as I mentioned earlier, this is helpful for being able to evaluate a program and if it works, and how do we monitor the progress that our client is making. Now, if we're to bring some more technicalness to this, it is really a repeated measurement of our dependent variable. What does that mean? It means we've got our dependent variable. What is the variable that we're looking to change? And so it could be looking to change whatever the problem is. Maybe a person has anxiety. We're hoping to change the anxiety with our intervention. So the dependent variable is anxiety. And that's what we want to measure repeatedly over time to then see, does it change? How does it change? To what degree does it change? And to what extent? How long does that change take? These are all questions that we can answer through this process. But to have that process, we need two basic components. We need a baseline, so we need to figure out where are we starting from. So we denote that with an A, the letter A. And then we've got our treatment phase. This is denoted with the letter B. Now, the treatment could be a one-time intervention. It could be something that's ongoing. But A comes first. We've got our baseline. B then comes next, our treatment. We can build off of that, but those are the two fundamental basic blocks. And then we want to graph it. And graphing can be a really helpful way of understanding how did this change take place. So with that, we want to be able to, as I said, take these repeated measurements over time. And so if we're measuring anxiety, and we have a new intervention that we want to try out. And so this would be a new treatment protocol for the anxiety. And so we measure anxiety at intake as part of the assessment. Maybe we measure it over a couple of days to really kind of get a baseline to understand where are we starting from? What is their normal level of anxiety like? Now, the thing is, it can, from day to day, anxiety can change over time. Just naturally, it might depend on the time of day. So we want to kind of get a couple of measures of anxiety before we introduce the intervention. Then we have our intervention, and we continue to then measure anxiety to see, is there any change? Okay. So now, in the event that you can't get that initial information and the person is just needs the intervention immediately, what we could do is we could ask others for information. We could check over maybe some prior case notes if the person had been into therapy before to find out what was their, what was their level of anxiety maybe, a couple months ago, the last time they were in therapy. Um, have they seen another therapist before? And so kind of accessing those records or even talking to family members if that's permitted and if we have permission. So, we can construct kind of that baseline, but it's ideal if we can measure it at the very beginning. Then, as part of that baseline phase, this is the period of time before we start our intervention. Okay, so we need to identify what is the status of the client on all of the variables that we want to look to change. Now, we said earlier that there's anxiety. Fine. What is that anxiety impacting? Is it impacting their work, quality of their family life, their sleep, their physical activity, their ability to pay bills, and their financial health? Is it impacting coping mechanisms? Are they drinking more or are they engaging in healthy coping mechanisms? These kinds of things. So these would be other variables that we may also want to measure alongside anxiety. Now, when we engage in this baseline phase, we also then are able to help address two aspects of what otherwise would be a control group, and we bake that into the control design. So we're not leaving them without intervention, but there's a period where they don't have that intervention. And so we can call that as kind of their control for our research sake. So 2 points here. One is that the measurements are taken until we can see some patterns. So at a minimum, you're going to need at least three to be able to see a trend. Maybe are they all going up? Is it just kind of flat? Is it kind of all over the place? Or is it going down? I don't know. It depends on your variable. But we want to, is it a stable line? Is there a trend? Or is there kind of like a cycle that might depend on the, time of day? But this serves as your control or life without the intervention. Then at the same time, some of these patterns um, can, address some of the threats to the internal validity. So basically, it can help shore up your design by having that baseline of and saying, okay, without our intervention, this is what life is like in all of its complexity. Next, we introduce the treatment phase. So this would then be the time period during which our intervention is implemented. We continue to measure those variables um, and using the same measurement tools. So if we're using the Generalized Anxiety Disorder 9 scale, then we're going to want to keep using that same scale. Now, if the scale is okay or if it's kind of lackluster, we want to continue using it. We don't want to change scales because then we're going to be changing our measurement. So as long as we're consistent about using that measurement, it actually matters less than how appropriate that measurement is. Ideally, we want to use a validated measure, but for instance, if we've got a measure and it works, we know really well for white folks, but not so much for African Americans. We don't want to compare African Americans to white folks, but we do want to at least use it consistently because oftentimes simply using something is better than nothing. So we want to just simply use that same measure. And it's also important then that we compare the outcome data to see, all righty, are there any changes that we notice during the treatment phase as compared to the baseline phase, okay, or that control period. So what does that look like? Let's bring a graphical representation here. Okay, so you can see in using a graph, it helps to illustrate what it is that we're understanding in which otherwise would be numbers. So having a picture can be a really, really helpful tool in this regard. Especially, if you're just kind of like calculating some numbers and averages, you're like, I don't know, was there much of a change? How big is that change? When you bring a graph to it, it's like, well, if your picture is worth 1,000 words, then graphing adds 999 more words to the picture of what was only otherwise given to us through just simply a number. So what you can see here um, in all three of these different graphs, A, okay, that's the period of where we're getting the baseline, and then B is after the intervention. So in this case, they attended a class, and so that's kind of the straight dotted line up the horizontal dotted line between day 7 and day 8. And so we see that overall, the anxiety levels baseline during A were higher generally than they were during B. And we've got different ways of calculating it or demonstrating it. But we see that on average, they are lower after the intervention, or they trend lower. Okay? So this provides a way of understanding and evaluating how successful was the treatment. It's very simple, but it's very important. And so, yes. All right. Now, as we will measure our targets for the intervention, um, which would be our variables, we want to know, okay, are these, which ones should we use? What areas of their life are impacting the problem? And so we need to talk with them. We need some context. We need to find out what are all the areas, in which it is impacting their life. And so that will tell us what to measure and then we need to figure out, well, how frequently should we measure? How frequently can they come in? Can they come in only once a week? Can they come in every day? So depending on the frequency, how long is it all going to take, depending on the issue, what are the intervals between them? How big of um, a measure are we going to be doing? And so basically you want to, who should do these measures? Well, a client can do their own measures, social worker can do it, the agency can gather it. Maybe you can cull it with a computer program. I mean, it's a wide range. Um, but one of the things that you can do in terms of these measures, well, you could just simply ask a person, well, how is your anxiety today? Hmm. That's a very subjective, way. Whereas if we use a validated scale, that brings a lot more sophistication and repeatable criteria to then be able to understand what's going on and see if we can find any change. So if in doubt, and if you can, use a validated scale. That's what it boils down to. Now, as we look at those different types of graphs, then this is a form of visual analysis where we can look at kind of the trends and then we interpret it and we can understand, well, what all is going on here. What's the significance of it? Does it mean that our intervention worked? Were there any things that maybe were outside of everybody's control, but that impacted what was going on? So we need to understand all of the context, and that's what you bring to the table as a researcher. And so with that visual analysis, basically, would we have seen the change without the intervention? Would we have seen it as fast? We have seen as large of a change? These are the questions that we want to understand. How has it all changed? And is it changing direction? If the anxiety was continuing to go up and then now we see it continuing to go down, that's a good thing. Um, how are the scores different? So what types of variation are we seeing? And so that's why you need to see, get a good baseline of repeated measures over time so we can understand just simply what is the nature of their life and what we would otherwise expect. Then we want to understand some of the visual patterns. So has it made a meaningful difference to the well-being of the person? I mean, that's why we're in social work, right? We want to make a meaningful difference and to improve the lives of others. So we also need to understand, well, as we're using these different measurements, understand what is this measure? Are there certain criteria for when it's appropriate? Are there cutoff scores to determine, well, you have moderate anxiety or severe anxiety? What level would we understand those to happen in? So what are some of those cutoff scores? And is there a cost benefit to, to all of this questions, and to understand this and ultimately to try this new form of an intervention with the client. Then sometimes, as we are trying to interpret this, the baseline is going to be all over the place. So we need to be as consistent as we can. Sometimes we maybe there's going to be changes, but we don't see them for a while until later. A lot of times that happens if they are taking medication. It might take a couple of weeks for the medication to really take effect. So you could measure it too soon, and then you won't see the impact that you were hoping. At the same time, sometimes you treat the anxiety, but you're missing a part of the picture. And so, there's going to be other factors that could be undermining what's going on, such as maybe some financial issues. You're just treating the anxiety, but turns out that's just a symptom. And if you're not treating the financial component underneath it that's causing the anxiety, maybe they've just lost their job, maybe their income is going up and down, and they're having a tough time paying their bills. If that's not addressed, then you're not going to see as good a change in treating their anxiety. All right. So basically, we want to see improvement in the baseline, but afterwards, what was life already trending in the right direction? And so it's just kind of continuing with what the baseline was already giving us in the first place. So that could also be a challenge, as part of this interpretation. So you need to have sufficient data going into it. Now, there's different types of single subject designs. And so the most basic one is where you have your baseline of A, and then your intervention period would be B. Then you can have kind of the withdrawal design. And so, we'll explore a little bit of what that one has. We've got concurrent ones that happen at the same time, multiple treatments, and ones where we want to simply monitor the client process. And then you can even do it with a group, okay? Even though it's multiple people, but it's one group. All right. So with the basic design, which is the one that we've been talking about, you've got your baseline, and then it leads, you move into the intervention period. So maybe the client has a history of getting better, but then they relapse regardless of the intervention type. So, you can't rule out history with this. And so it's impossible to conclude truly that the treatment caused the change. But it can be used for research and evaluation and just simply monitoring the client. Now, when you have a withdrawal design, that's where you then have a period of follow-up after the intervention. Okay, so once the intervention is done, you've got a follow-up later on. So, for example, um, you know, this could be where I conducted eviction prevention, and uh, it helped prevent the eviction. But then I continued to follow up. How was their, all their mental health and, housing status and so forth, upwards of a year later. So we wanted to follow up with that. And so you can do it with just simply following up with another baseline assessment to see if there's a new baseline, or we can actually have a second stage of intervention. Now, some of the issue here is that you've got the impact of an intervention that may persist after the treatment phase. And so we want to know, um, you know, is this a good thing or is it a bad thing? It's simply something to know and be aware of. When you have concurrent multiple baseline designs, these are with individuals, but you've got more than one individual. I know that seems a little kind of counterintuitive for a single subject, but bear with me here. And so what we're doing is that we're simply comparing maybe say three different clients or at least three different clients, but we're trying to take out this issue of history, and really kind of making it so everybody is it's truly because of the intervention that we are seeing the change. And so we have different baselines and different durations of baselines. Maybe it's only 4 weeks or 8 weeks or even 12 weeks that we're gathering the baseline, and then we introduce the intervention. All told, it's still 16 weeks, but people receive their interventions at different stages. So this can be a way for us to make sure that, yep, it really is the intervention that's causing this, and it's not something to do with different history. But these people have to have, all the same type of characteristics and same type of implementation of the intervention and so forth. So there's different ways of doing multiple treatment designs where you've got the intervention may actually change over time. And so this presents kind of a new phase of the design. So you can change the intensity of it. So perhaps you're adding some additional intervention activities. So going back to our anxiety issue, maybe the person just simply starts out with therapy. And then after a week, they add in therapy and meditation. And then after another week, therapy, meditation, and journaling. And then after a fourth week, they also, in addition to therapy, meditation, journaling, they also then tally up their debt and start paying it off. And so we start kind of increasing the intensity or the complexity of the intervention itself, but we're doing it in a systematic manner. An alternative treatment design would be if we try different things to see if there's any change, or if there's any one thing produces a more significant change than the other pieces. So that would be try therapy for a week. And then the next week, no therapy, but only meditation. The week after that, only journaling. And then the week after that, looking at the debt and paying that off. And then we would see, does any one of those have the most impact? Again, we don't want to be frenetic. We don't want to be haphazard. We don't want to be random. We have to be systematic about this, but you can introduce different types of activities into the research design. Now, we have to monitor client progress. We need a baseline, ideally. But if we can't get a baseline, sometimes you just got to start with the intervention and then see how it goes. And so do we see a trend in our dependent variable? Does it continue if we, simply have then a measurement of, maybe one or two measures of the anxiety? All right, so be it. And then maybe we can show, like, after one measure of the anxiety, hopefully it goes down. But, if we have a more sustained period, we can begin to show decreasing levels. So again, perhaps I use $2,000 to prevent eviction. Does this prevent eviction later over the course of the year without adding any more money? So we see how long we can last with the intervention. Now, with all of that, you can have different designs used different levels of society. As I mentioned, you can use it with groups. One example could be if you have a trauma and financial efficacy group, and we want to see, all right, what are the outcomes of having being able to engage in a trauma group and at the same time receiving instruction and skill building in financial efficacy. What types of outcomes can we see with that? And so we would study it with one group and then observe what are the changes over time. Now, there's different ways to enhance how we do this, especially when we're talking about evidence-based practice. And so we can replicate this intervention with many instances of the same situation. And so, for instance, people who came to me were almost always women, and they always had children in the school, and they were always facing eviction. And so I simply replicated it to see how many we were doing this. Now, the thing here is that when you're doing other types of studies, you can't get 15 people all at the same time who are all facing eviction, because they'll be facing eviction at different stages and different times. So you work with one at a time, and then you add up, kind of the results later on. Now, there could be systematic replication. And so this helps clarify some of the conditions for success and the appropriate client characteristics. And so you would have, maybe a different setting or different characteristics, different populations that you're trying it out with. And then there's the clinical replication, where you combine these different interventions into a package to treat multiple problems. So this would be kind of what I had mentioned earlier, where we're talking about trauma and financial issues. And so as a result, one of the things that they found was that people had food security improved, housing stability improved, their PTSD improved, so on and so forth. And so we have, with that, it's a really important tool in our toolbox where we can treat an individual as an individual and not necessarily, and to meet all of their needs as an individual, uh, regardless of whatever ethnic or underrepresented group that they may be coming from. And so, it's important that these folks, we design interventions that are going to help them and going to help them, the most marginalized and those who are perhaps underrepresented in research. So this can be a way that we can introduce some of these best practices to new groups that otherwise would not have access to them. It is important, though, that we also be sure to try and test for cultural variations and to understand, does this measure work with this type of group? And so it's important to then remember that because this research focuses on one individual, you have to be very, very careful always to obtain informed consent from each and every person. Thank you very much, and I will see you in class.